Assalamu alaikum,
My
sir.
son.
Say, while doing my clinical rotation, I've seen a patient with a swelling on the neck. What is this?
Okay, this swelling in the neck, it is in midline ideally. It can be an ectopic thyroid, it can be a thyroglossal cyst, it can be a dermoid or an epidermoid cyst, it can be yet the brachial cyst. Was it, moving with deglutination?
No, it was not.
So if it was not moving with deglutination, then it's not a thyroid swelling, in fact. Was it, moving upwards with the protrusion of the tongue?
Yes, it moved up.
It moves up. Look, so in this case, it is obviously a thyroglossal cyst because the thyroglossal cyst moves up when you protrude the tongue outwards. While the other two swellings or three swellings which we just discussed, like the epidermoid cyst, the dermoid cyst, and the brachial cyst, they do not move with any deglutination or even with the movement of the tongue. And yet again, the location of brachial cyst is on the anterior border of the sternocleidomastoid mastoid. The rest, all of them can be in the midline.
So, say, what is actually a thyroglossal tract?
Okay, thyroglossal tract. Look, what happens is in the embryological life, thyroid tissue originates from the foramen cecum of the tongue. It descends down through the body of the tongue in front of the hard bone, then in front of the larynx, and then comes to the usual position in front of the trachea. That tract is known as the thyroglossal tract, and if that tract remains patent somewhere, there is a collection of fluid inside an epithelial lined cavity, which is known as the thyroglossal cyst.
Oh. So, is the thyroglossal tract related to the ectopic thyroid?
Ectopic thyroid. Yes, 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 yes. When the thyroid is descending in through the thyroglossal tract, the thyroid can remain at any point in the descent, in the root of the tongue, in front of the hide bone, in front of the trachea, as well as the larynx, and all of those positions will be known as ectopic thyroids.
Oh. So, what is the treatment option?
The treatment option for a thyroglossal cyst is a surgical procedure which is known as cyst trunk surgery, and in that surgery, we just enucleate the cyst with the epidermis because if the epithelium is not removed, the cyst will reoccur. And in this procedure, we have to prevent the hard bone as well.
Wow. Thank you, sir.
You're welcome.